Brought to you live by WVU Medicine, Camden Clark. My guests tonight are Dr. Christopher Kalinda, President and CEO of WVU Medicine, and also Dave McClure, President and CEO of WVU Medicine, Camden Clark Medical Center. And we are discussing recent changes at Camden Clark and our relationship with WVU Medicine. If you have questions regarding this topic tonight, please call 304-424-5112, or you can always email us, forum@WTAP.com. Camden Clark's Cancer Center recently was renamed, and since I am the director of our Cancer Center, our producer met with me last week to discuss our name change. Let's watch that interview now. The new name of the Cancer Center is WVU Cancer Institute, Camden Clark Comprehensive Regional Cancer Center. And we're very proud of this title. We've worked very hard for many years, to be accredited as a comprehensive cancer center. And we are very well respected in the state, as is the Cancer Center at WVU. So this partnership just seems like a very natural thing for us to do as part of the WVU Medicine health system. And what that is just stating that we are part of the WVU Medicine health system, as are a few other healthcare facilities in the state. And as part of this healthcare system, the leadership is made up of a lot of different people from all of these facilities, and they came together and really have worked hard to come up with a good way to, as a network of facilities, address the healthcare needs of the people in West Virginia, and what are the areas that we really need to focus on. And of course, one of those was cancer. So with one of these priorities from the health system being to address the needs of cancer in our state, since it's such a high incidence, if we all come together and take the opportunity to standardize our care across our facilities, to work together for organizational purposes, opportunities for facilities, for research, whatever we can do to help our partners in the network, we're going to do. And in doing that, we are improving the health of all of the population in our state, as well as providing the state-of-the-art care and the best access to care that we can across the state. Being the first of the network facilities to belong to the West Virginia Cancer Institute is very exciting for us. And when you think about WVU Cancer Institute, of course, there's a lot of prestige that comes along with that. When you think about Camden Clark and its history of cancer care is also very prestigious and very well respected in the state. So the partnership just seems, again, just a very natural thing to do. And both of us have a lot to offer each other. Of course, as kind of the larger and more advanced center for some things, we'll have better access to that for the people in our community, the things that we might not be able to provide here. But in saying that, our history is so rich and our physicians here are so well experienced that, we're all just very proud to be a part of that. For the people in our community, some of the things that they might be able to access through our cancer center that they might not be able to find elsewhere, as with our partnership with WVU Cancer Institute, not only are we able to do all the great things we've been doing all these years, such as diagnosing and treating cancer and participating in clinical trials, but now we can expand that through WVU Cancer Institute to go on to the furthering and the research, the earlier detection, the more advanced treatments, the more advanced trials. And one of these days, who knows, perhaps something that is done within our network and our community might find a cure. The Cancer Center at Camden Clark offers a full range of cancer treatments to the patients in our community. We have medical oncology services, radiation oncology services. We have an inpatient oncology unit. We have access to clinical trials, and we also have access to genetic testing. And part of the medical oncology piece also includes biotherapy and immunotherapy, which might be a little bit of a newer type of a treatment. Some of it's not, but those are new words that you hear more often now. So that was a little different for me to be on the interview side of that. but it certainly is something that the cancer program that we are very excited about. And Dr. Kalinda, you mentioned earlier on that cancer was a part of a signature program. So, for our viewers that probably haven't heard that before, explain to us what a signature program is and how the cancer program fits into that.
So when we talk about signature programs, we're principally talking about how we can begin to differentiate our academic medical center into what we call service lines of excellence. And we have designated 6 major service lines that we're going to focus on in terms of building out the infrastructure, recruiting talented individuals, and begin to start linking together the clinical care with discovery and opportunities for research. First one is oncology, and that's under the umbrella of the WVU Cancer Institute. The second one are cardiovascular services. The third is neurosciences, which includes things from behavioral health through stroke and other types of neurodegenerative diseases. Mm-hmm. The fourth one is trauma critical care. We are one of 2 level 1 trauma centers in the state of West Virginia. And we tied to trauma care as critical care. So we have an increasing expertise in managing very complex patients who have sustained trauma and have all the complications that ensue from that. And then the next one would be children's health services. Mm-hmm. We have a large children's hospital, and we're actively building out opportunities for children's services. And then specialized surgeries. Surgery is hopefully there are surgeons listening to us tonight on the show, but as many surgeons know, surgery has become increasingly more sophisticated, and there are some surgical specialties and some surgical procedures that are best done in. There's an old adage: the more surgeries you do on a particular type of surgical procedure, the better you come. So we're looking at some specialized surgery services to enhance the access of care. Now, all of this is designed towards if a patient needs it and the patient can't get what they would want to have in terms of their level of care in one of our community and regional hospitals, that they don't have to go out of state, that those services would still be found within the state and would have the same quality as they might experience if they went out to places north, west, or east, as they say.
And Dave made a good point earlier that would be a seamless.
Yes. And the key to that seamlessness is we are rolling out our electronic health record to all of our facilities. And so that the patients who have a medical record here on our new Epic system, which will be rolled out in the next couple of years, the physicians, whether they're at Ruby or out at Berkeley, they will be able to pull up that record, and all the data that is available for that patient is found in one common medical record.
Mm-hmm. Dave, why do you think there's a need for the signature programs as far as bringing everyone together and the access? It might be you pretty much just said it, but.
Well, it really does give us the continuum of care that we may have lacked in the past. When a patient came in with a major trauma, if we could not care for that patient, we may have chosen Ohio State or CAMC or some other facility in the state where we may not have had access to WVU and Ruby Memorial with a level 1 trauma center. Now, with the signature programs and also with the connectivity of our system, it truly is a seamless event. Helicopter or critical care ambulances on site almost immediately, transporting that patient to the university where they have that level of sophisticated care to be able to provide the best care for that patient, in the sense that we may not be able to provide that care. And certainly we provide the best care possible to our patients here in the community, but there are times when there are highly technical or highly complicated cases that they are best cared for at the university. And Dr. Kalinda mentioned that the more you do and the more patients you see with a specific injury or illness, the better care that's going to be provided at that level.
Now, Dr. Kalinda, at the beginning of the health system, or when you entered the health system, was this type of of a large range program what your vision was, or has it grown into this as perhaps more facilities entered the system?
I think it's an our vision, not just my vision.
Mm-hmm.
We went through when I became the CEO, we went through a 6 to 8 month strategic planning process, and we began to try to position the various resources within the system to try to figure out how healthcare will be delivered in the future, and position our organization, our structure, and our functions along what we think the future will bring. I ask the CEOs all the time, I said, what patients are you admitting to the hospital today that you won't be admitting to the hospital in 5 years? And when you start thinking about the questions about how you need to adapt your systems of care to meet the challenges of the financial changes that are going on in healthcare, the advancement of technology that allows more and more things to be done as an outpatient or in other types of care settings, the whole issue of post-acute care, how we maintain patients in a healthy condition and not have them bounce back and forth from hospitalizations, and how we ensure that all patients have local primary care and the appropriate and necessary access to specialty care. You begin to start asking very strategic questions about how you position your resources.
Mm-hmm. And I know it's certainly, and it's ever changing.
Yes.
As you mentioned,
Healthcare
the
reform.
coverage, even the coverage for our patients is so different. And we did a forum when did we do the forum about the coverage, trying to explain it. People just don't understand it.
It's very confusing.
And it is confusing.
And perhaps you can have Mr. Early on the show one night to help.
He was.
He was on our forum.
He was.
Yes.
Fred and I are good friends. So.
Yes, we actually had a very good conversation about that, and the viewers do want to know, because it does affect them, of course.
Yes.
And their
And,
access.
in previous shows that we've been together on, we've talked about not only the development of our relationship with the system, but also the merger of the two hospitals here in the community. More and more procedures are done on an outpatient basis. Technology and technique has really allowed us to reduce our capacity and allow patients to heal at home in a comfortable environment. Nobody wants to come to the hospital to spend an extended period of time in the hospital, when if we can provide that care on an outpatient basis or on a short stay basis and allow them to heal at home or in another environment that is a much more comfortable environment, that's really our goal. And the relationship and the development of the system will allow us to do that.
Let me add on to that. When I was what I call a real doctor, I focused in my area, especially was in geriatrics. I never once met a homebound geriatric patient who said, I really want to go to the hospital.
Right.
Most of my patients would say, can you do something for me here and now, as opposed to, I don't want to go to the hospital. It's overwhelming, and sometimes, to be honest with you, it was better to have their home care done at home as opposed to having those types of services delivered in a facility, just for safety reasons.
Right. Right, and we do have to think about what's best, not only what's best for their care, but what's best for their recovery.
Exactly.
So that's good. Okay, well, we are going to go ahead and take another break right now, and we're going to return to answer all the questions that have been collected by our representatives. So don't go away.